Good morning, dear panelists, and welcome to this presentation session on hepatitis B virus prevention. My name is Ngoupa Joel, and I am a PhD student in the University of Buea in Cameroon, and I'll be presenting to you on the title Seroprevalence and Associated Risk Factors for Hepatitis B virus infection among Barbers and their clan in 2 cities of Cameroon. This is paper presentation number. What motivated us to carry out this study is the fact that hepatitis B virus infection is a serious public health problem in Africa and worldwide. Also, hepatitis B virus is highly infectious and can survive outside the body for several days. In addition, barbers are regularly in contact with the blood fluid of their clients who could develop skin cuts and abrasions during shaving practices. Furthermore, there is few or no data on hepatitis B virus infection among the study group in Cameroon. Hence, we determined the seroprevalence and risk factors to hepatitis B virus among barbers and their clients. Our overall objective was to determine the frequency of hepatitis B surface antigen among barbers and their customers, to determine the knowledge of barbers and customers with regard to hepatitis B virus infection, to assess the practices and risk factors of hepatitis B virus infection, and raise awareness about hepatitis B virus infection among the study population and encourage hepatitis B virus. To carry out this, the following method was used. In step 1, we obtained authorization from the ethical committee and the director of School of Health Sciences and the divisional officer of Yaoundé and Douala. The next step, we went to the field and seek for consent from the participant in order to sample blood, which we later on went to the lab, centrifuge, and carry out a rapid diagnostics test. All samples that were positive to the rapid diagnostics test were confirmed using an antibody sandwich ELISA technique, and all our samples were stored in a freezer at negative 180 degrees Celsius. Post-test counseling and sharing of results was done to all the participants, and only those that were positive were referred to the gastroenterologist for follow-up. These are the results that we obtained. We can see here that the seroprevalence of hepatitis B virus is higher among barbers than their clients, and this was in the 2 cities of Cameroon. Also, of the 75.6% of participants who had heard about hepatitis B virus infection, 24.4% had no idea about the mode of transmission, while 63.7% ignored the transmission through barber shaving practices. This is in line with the study of Babacha and al. In 2010, who found that this study population are mostly unaware of hepatitis B virus infection through shaving practices, through shaving tools. The higher risk frequency of hepatitis B surface antigen can be accounted by the lack of hygienic condition before and after shaving practices, as stated by Wazi and al. In 2008, and poor knowledge, as stated by Babacha and al. In 2000. So we are concluding by saying that the seroprevalence of hepatitis B virus is high among barbers than their clients and the general population. Hence, barbers may be at higher risk than the general population. More than 3/4 of the study population had heard about hepatitis B virus infection but had poor knowledge about the mode of transmission, since they mostly heard from word of mouth. As perspective, we intend to carry out the same study on a larger population and screen for different markers of hepatitis B virus in order to determine the stage of the infection, either chronic or acute. Also, you intend to use bioinformatics to help to determine cross-contamination resulting from the use of shaving instruments and practices. These are our references, and we want to thank all the actors who made this study to be possible. We thank you for your kind attention.